Okay, good morning, everybody. My name is Jennifer Walsh. I'm a Senior Media Officer with the National Academies of Sciences, Engineering, and Medicine. Thank you all for joining us this morning. Again, those of you who are here in the room and those of you joining us via webcast, this is a public briefing to release our new report, Global Health and the Future Role of the United States. The report is now available to download in a free PDF format, as well as some other related materials at www.nationalacademies.org/US Global Health. Again, that link is www.nationalacademies.org/US Global Health. And if you'd like to follow the conversation on Twitter, the hashtag is #US Global Health. For those of you not familiar with the National Academies of Sciences, Engineering, and Medicine, we are private, nonprofit institutions that provide independent, objective analysis and advice to the U.S. to solve some of the complex problems and inform public policy decisions related to science, technology, and medicine. The National Academies operate under a congressional charter to the National Academy of Sciences that was signed by President Lincoln in 1863. For each requested study, panel members are chosen for their expertise and experience and serve pro bono to carry out the study statement of task. The reports that result from the study represent the consensus view of the committee and must undergo external peer review before they are released, as did this report. So this will be a 1-hour public briefing unless we run out of questions beforehand. We will start with some opening remarks to introduce the study and give an overview of the report's recommendations. And then we will open up the floor and the web to questions. Those of you in the room, if you'd like to ask a question, I ask that you please go to each of the microphones here in the room. And those of you watching the webcast, you can type in a question in the Q&A box down below, that's below the video viewer. Lastly, I ask if anybody has a question, if you can please identify yourself and your organization before asking a question. And with that, I'm going to turn it over to Dr. Victor J. Zhao, President of the National Academy of Medicine.
Thank you, Jennifer, and good morning to every one of you. Good morning. Great, thank you. I want to welcome you to this report release. I would certainly say it's a long-awaited report of great importance to many of us who care about global health. And the report is called Global Health and the Future Role of the U.S. I'm Victor Zhao, as you heard, President of the National Academy of Medicine, formerly known as the Institute of Medicine, or IOM. Now, I think we all know that U.S. is a leader in global health. In fact, U.S. government is the largest global health donor in the world, contributing more than $10 billion a year annually. Indeed, the U.S. government's remarkable relationship has resulted in considerable success with notable progress achieved by, for example, PEPFAR, President's Emergency Plan for AIDS Relief, President's Malaria Initiative, and his commitment to Global Fund to fight AIDS, TB, malaria, Gavi, the Vaccine Alliance, and Every Woman, Every Child's Global Strategy. And as a matter of fact, there's been strong bipartisan support along with relatively stable funding for global health the last 15 years. And I'm sure that contributes to our great success. However, we are now at a potential tipping point for U.S. global health policy. This comes as the U.S. and rest of the world enter a particularly challenging global health era with new and recurring crises crowding the policy agenda. Factors such as increasing globalization and urbanization have contributed to the emergence and reemergence of infectious disease outbreaks such as Ebola, Zika, and SARS, and MERS, and many others, and to microbial resistance on the rise, and of course, the non-communicable chronic diseases like diabetes, obesity, cancer have continued to grow in their prevalence, impacting on economies, threatening societal gains in life expectancy and quality. Now, the new U.S. presidential administration is faced with the task of addressing these emerging challenges while ensuring that gains from the past support for persistent health challenges in areas of HIV, malaria TB are sustained and poised for growth. So you all know that with the recent change in administration, there's some uncertainty about what's the future and what's the priority. And this is how we hope that we can be helpful in national academies, because as you heard from Jennifer, we've been advisors to a nation ever since 1863. Over the past decades, the work of the Institute of Medicine, or IOM, has had many influences on global health policy in U.S. For example, the U.S. government asked us to evaluate the performance and impact of PEPFAR in its 2008 reauthorization legislation, and we produced key reports to advise government administration on other global health policies. In 1997, IOM was commissioned to produce a report, America's Vital Interest in Global Health, that addressed U.S. interest and commitment to improving global health. In 2009, we prepared the report, The U.S. Commitment to Global Health, Recommendations for the New Administration, to advise the incoming President Obama and his team about future priorities and opportunities to improve health worldwide and protecting and promoting U.S. health interests. So we're very gratified to see that over the years, many of the principles and recommendations from our reports have actually reflected in U.S. global health policy. So building on this history and in anticipation of the new administration, the Board of Global Health of the Health and Medicine Division of National Academies launched this study that you're going to hear about to identify global health priorities in light of current and emerging changes. With the support of 9 sponsors, we convened a 14-member committee with diverse expertise and outstanding credentials in areas of security, technology, NCDs, diplomacy, financing, etc. The committee was ably chaired by Dr. Valentin Fuster and Jendayi Frazer, and they are with us here today. We're also joined today by several of the committee members who's also done a great job, Amy Batson, Mike Merson, Michael Osterholm, all of whom will be introduced, I'm sure, by our co-chairs. I want to say a word about the excellent staff. Megan Sneer, who really did a great job leading this, together with Ashand Kendekar, Elaine Hines, Julie Pavlin, and Cici Mandaka Shah. Now, the committee, as you hear, was charged with providing recommendations how to increase preparedness, responsiveness, coordination, and efficiency, both for the U.S. government and across the global health field. It's very clear they have their work cut out for them, and I know they work really hard and extremely thoughtful in putting together this report, and I'm very grateful to them. I think uniquely, they not only talk about disease and areas, but they create a framework for the future in U.S. role in global health and identify key opportunities for change. And these areas include strengthening public health in U.S. and other countries, rethinking the way we finance health aids to other countries, harnessing innovation and technology to address global health challenges, investing in digital health infrastructure and data. You'll hear about them, and leveraging multilateral organization, private sector. So as I turn it over to the co-chairs, I just want to thank the committee and the staff for the outstanding work. I know they spent hours tackling this topic, and I know we'll see the efforts reflected in this report. And with that, I'd like to turn it over to the co-chairs who walk you through the report recommendations and also introduce the committee members. Again, thank you very much, Jendayi and Valentin, for your great work. Thank you.
Well, thank you very much. I am Valentin Fuster. And first of all, I would like to give my thanks to the National Academies of Science, Engineering, and Medicine, to the sponsors, and certainly to the committee, and to my fantastic co-chair of this committee, Jendayi Frazer. And certainly to you that came here today to at least listen for a few minutes of what this project or this consensus is all about. And actually, if you move into the next slide, let me begin by why invest in global health. and there are three main points. First of all, the tremendous growth in international travel and trade that has occurred over the last several decades heightens the urgency of continuing investment in global health. And now comes point number two, why United States should be involved. First of all, we should be all motivated by the fact that securing protection against global health threats affects everybody, including United States. At the same time, we can promote productivity and economic growth in other countries. But the basic issue here that I want to emphasize is the issue of security threats. The next point that I would like to comment on is investing in global health over the next 20 years can save the lives of millions of children and adults and result in positive returns on investment. So on one hand, we have the issue of security threats. On the other hand, we have the opportunity for shared solutions to common problems. Just to add, according to the Lancet Commission on Investing in Health, the return on investments in global health can be substantial, as the benefits can exceed the cost by a factor up to 20 for low-income and lower middle-income countries. If I can have the next slide, please. Here is the committee that participated. We were asked to begin to meet about a year ago, and as we will see in the next slide, it has been a process. We hosted a number of committee meetings in September 29, December the 6th for information gathering and public comment, September 30th, December 7th, January 5th and 6th, and February 2nd and 3rd were closed to committee only. But furthermore, we asked or solicited expertise of 62 people who really understand the field that we put ourselves into discussing for the document. We prepared a 10-chapter report, and actually, after the report was done, we asked 17 experts to give their opinions and certainly to be critics of the report by itself. On the next slide, we have the sponsors of this document, Medtronic, Becton Dickinson, Rockefeller Foundation, PEPFAR, the National Institute of Health, CDC, Merck, USAID, and the FDA. Thanks to all of them, as we mentioned before. And now maybe I will ask you, Jendayi, to give us a sense of the process.
Thank you very much, and it's a great pleasure to be with you, and thank you all for coming this morning. The committee had a very comprehensive and extensive charge. It was really quite something that we needed to prioritize. First, we were asked to review the reports of the past IOM reports of 1997 and 2009. Then we were asked to assess the global health landscape that has changed over the past 8 years, to offer recommendations on future priorities to key stakeholders, and then to review and offer recommendations on how the U.S. government can improve its responsiveness, its coordination, and its efficiency. And so we assess. In that charge, we decided to really focus on assessing the global health landscape and then offering recommendations on how the U.S. government, and that being the administration and the Congress, can do better and to leverage more to achieve the global outcomes that we all think are so very important. As you can see, when we looked at the relevant changes in the global landscape, we pointed to globalization as being very key, mainly that there's been more trade and more travel, greater interdependence, which of course can lead to greater pandemic threats, epidemics, but also, as Valentin just said, offers an opportunity for shared solutions to common problems. We also looked at the growing frequency and infectious disease epidemics, antimicrobial resistance, the culmination of the MDGs, the increasing privatization of healthcare and how we can leverage that more, and then the increasing importance of non-communicable diseases, especially on productivity and the costs of such. But again, we had to focus, so while we had many different areas which we thought should bring attention for global health, we had to decide which ones we were going to prioritize. And that's what this report does. If you turn to the next slide, or to that slide, actually, we chose 4 priority areas for action. One is achieving global health security. All of these will be covered over the panel: maintaining a sustained response to continuous threats of HIV, AIDS, TB, and malaria, to save and improve the lives of women and children, and to promote cardiovascular health and prevent cancer. These are 4 priority areas where we think the United States has made significant investment in the past and should continue to build on the progress that's been made. Our approach was one that looked at trying to get out of the silos, focusing on particular diseases, and rather embrace a more system-focused concept of integration, capacity building, and partnership. And then finally, our strategy was to look at cross-cutting areas that we could leverage, specifically ways in which we can catalyze innovation through accelerating the development of medical products, enabling harmonized digital health infrastructure, creating greater interoperability, optimizing financing strategies, really more blended finance approach of leveraging the private sector and the public sector and the donors, foundations, international organizations, and then maintaining U.S. leadership in global health architecture, focusing on ways in which we can pass new legislation that will allow the State Department and the Health and Human Services to be more on the front lines of global health without necessarily leveraging more money, but actually leveraging our talent and our expertise and our people. So what we came up with was really a new approach to doing business in global health. And that approach focuses on 2 primary objectives or interests. The top one being securing against global threats, protecting our people at home and abroad, and then also enhancing productivity and economic growth, recognizing that many diseases are undermining economic security, which when economic security, especially in many of the low and medium income countries happens, you get conflict, which then puts us at greater threat and also undermines all of our global health investments. So our interests, our 2 objectives are securing against threats and enhancing productivity. And then we look at our 4 priorities underneath that. Again, where the United States has unique strengths and has done major investments in the past on global health, dealing with pandemics like Ebola and Zika and SARS that have been mentioned, on continuous communicable disease threats, especially HIV, AIDS, TB, and malaria. Then looking at investment in a healthy population, particularly saving and improving the lives of women and children, and areas that are creating a huge economic burden, especially the NCDs promoting cardiovascular health and preventing cancer. So those are our 4 priority areas within those 2 major objectives. And then we look at cross-cutting areas where we can actually maximize our returns by leveraging these 3 areas: catalyzing innovation, smart financing, and global health leadership across the 4 priority areas. And so that's really our strategy. We need to change the way we do business to be better in our innovation and better in our leveraging of our resources. And so maximizing returns through those 3 means, and again, the panel will speak in greater depth to that. And now I'd like to turn over to Mike Osterholm, who will talk about the global health security.
Thank you very much, and it's a real privilege to be here with you this morning. Let me just set the tone for this particular presentation. Think about the news media of the last 72 hours. An outbreak of Ebola in the Congo, 4 new cases of MERS in Saudi Arabia, an additional new case cluster reported for H7N9 influenza in China, the yellow fever op-ed piece in the New York Times indicating that if in fact yellow fever does continue to spread in the cities of Brazil, we will run out of vaccine and be unable to respond, a possible polio outbreak in Syria, ongoing expansion of the meningitis outbreak in Central Africa, now extending for the first time into West Africa, and at least 3 different new reports on yet previously unrecognized sequelae of Zika virus in young children. You don't need to continue to read the media to understand these are now, immediate, and real. So what we did, and we covered on our area of global health security, the key threats remain the zoonotic spillover from animals to humans. Many of these diseases I just mentioned, in fact, represent that very piece. Pandemic influenza, which is, in a sense, the king of infectious diseases, and the fact that we still are largely unprepared globally for a new influenza pandemic. And the importance of antimicrobial resistance, something I didn't mention, but is really like a slow-moving tsunami that is going to affect us increasingly so over the next several decades. Why is this happening? Well, we continue to see poor public health infrastructure and preparedness around the world. We tend to rush from crisis to crisis, where we virtually throw the kitchen sink at the crisis and then walk away and really have very little to show for what we did to build any kind of permanent infrastructure to respond. We have vulnerable supply chains and slow medical countermeasure development. We still don't have a licensed Ebola vaccine. We're not any closer to having either an animal or human MERS vaccine. Our influenza vaccine is grossly inadequate to respond to a global pandemic. Yellow fever is short in supply. Polio, we have shortages of polio vaccine right now. We don't have enough meningitis vaccine in Africa, well-known, recognized shortages there right now. And we don't have a vaccine for Zika. Do I need to remind anyone why we have a countermeasure problem with the issues I just addressed? And also we have fragile states threatening global success. Let me tell you, there was a time when public health was a much easier endeavor. Think back into the 1960s when the United States and the former Soviet Union decided to eradicate smallpox. We had a good vaccine, we had a disease easily recognized, and we had a way to do ring vaccination quickly. Well, people all think it was about the science. It was as much about the public policy as it was the science and governance. Because when the United States and the USSR decided to do anything, every country in the world was a domino behind one of those two countries. And when they both agreed to do something, the entire world fell in order. Today, we don't know who's in charge in many countries of the world. We have great difficulty trying to carry out public health programs. Imagine over 100 polio eradicators assassinated in Pakistan and Afghanistan just in the last 2 years trying to complete that job. So the challenges are many. The costs are obvious with pandemic, and if you go back just one slide, I'm just going to mention the pandemic issues. A cost of, you look at SARS and Ebola, and you can see the implications. Next slide. If we do go into the challenges, you can see rapid urbanization, biodiversity loss. Let me make it very clear today, the world is in unprecedented change. Today, with almost 7.6 billion people on the face of the earth, 1 out of every 8 people who's ever lived is now on the face of the earth. And the greatest growth is in the megacities of the developing world. We no longer are an agrarian world in terms of where people live. The biodiversity loss is huge in the sense of where do we come in contact with these infectious agents. In many cases, they emerge from the areas of the world where we're seeing the greatest biodiversity loss, the rainforest. We have complacency following periods with no emergency. Look no further than the United States. Our public health budgets for response are like yo-yos. When we have a crisis, we tend to fund it, and then within a very short period of time, we forget. And we have to come back and revisit this over and over again. Also, just globally, there is no more tragic but really telling story about that than Venezuela. Think about the first country in the world to eliminate malaria out of the populous regions of its country was Venezuela in the 1960s. Today, we have widespread urbanized malaria because we had a governance structure, an economy that collapsed, and basically people, doctors, lawyers, architects, nurses could not find work and then migrated back into the rural areas of Venezuela to do illegal gold mining, where they then came in contact with malaria, developed malaria, have brought it back to the major cities of Venezuela, and now we have established urbanized malaria. That was only 45 years ago that that country did what it did. And so we have to understand that every time we have a victory or an achievement in public health, that does not guarantee that it will stay. It takes care and feeding consistently to make that happen. We need to work across country and regional lines. We realize infectious diseases know no political boundaries. They don't know oceans or mountain barriers. And that, in fact, today we have to know that any time a disease occurs somewhere, tomorrow it could occur everywhere. And so we have to be prepared to respond in that regard. And when you look at the United States, we have no clear leadership right now or division of responsibilities for agencies involved in international response. The previous report from the National Academy of Medicine on the Ebola outbreak surely highlighted that, as has others.
When you bring together public health, you bring together State Department, you bring together even the potential military for logistical support and control and command, basically we don't have a system today for how we integrate and coordinate and lead those kind of efforts. Next slide. In terms of what are the needed actions on a domestic level here, we need a new proactive approach for public health emergencies, embracing prevention and preparedness, which includes, one, creation of a single coordinating body to guide international public health emergency responses. We realize that this is international emergency we're talking about, but for domestic, because so often these spill over quickly into the domestic arena. Imagine what happened in our country with just 2 cases of Ebola in hospitals here in the United States, and we saw this challenge. Imagine if we'd had Ebola cases in many of our hospitals in the United States. We would have been terribly inadequately prepared to respond. We need dedicated funding for domestic preparedness, response, and medical product development. I have to just come back to, a few of you in this room are old enough to remember the old oil fram commercial 20 years ago that said, you can pay me now or you will pay me later. And we repeat that over and over again, and every time we do that, the cost of paying later is so much more significant than the cost of trying to develop the response capability and the medical countermeasures now. And then finally, improved coordination with multilateral organizations. The U.S. government in of itself is not the only organization that will respond. They are a critical organization. They have the legal standing in many cases. But today, the philanthropic organizations, the NGOs, all play critical roles in supporting that response, and in many cases, serving as a primary responder in those situations. Improved coordination is necessary. Finally, just needed actions on the international level. It's necessary to build a core preparedness capabilities in public health infrastructure internationally as well as domestically. Let me just say, several weeks ago, Mark Olshaker was in the audience, and I had an op-ed piece in the New York Times in which we emphasized that national security is all about infectious diseases. Because, in fact, what occurs anywhere in the world is much more likely to cause potentially devastating impacts here in the United States than many of the issues we often think of and associate with national security. We have to understand it's not just being altruistic to care about the rest of the world, it's strategically wise, because in fact we often will end up paying for it anyway. In terms of this, we need a coordinated and dedicated effort to combat antimicrobial resistance nationally and internationally. Make no mistake, antibiotic resistance is a slow-moving global tsunami that will swallow us eventually. The AMR report that came out of Great Britain last year, which was by far the best review of this topic to date, estimates by 2040 the number of deaths globally from antibiotic resistance will surpass the number of deaths globally from cancer and diabetes combined. So we have to begin to address that in a more effective way. We need to build public health capacity in our low and moderate income countries, including disaster risk reduction and disaster response. It's not enough to go in and out during the crisis. We've got to understand that the basic infrastructure is there and is necessary for us to respond. And finally, as I mentioned before, we must align with effective multilateral organizations. This is a partnership. This is not a one-off. And so today, our goal is to help the U.S. government in any way we can to realize a more coordinated global effort and what the return on investment will be to that. Thank you.
We'll move on to the infectious diseases, and I won't spend much time here because we're focusing on HIV/AIDS, tuberculosis, and malaria, and we know since 2000 there's been significant progress in reducing new infections as well as preventing the rate of death, the mortality rate. You can see those numbers above, with tuberculosis not actually achieving the same level of progress in treatment and prevention as HIV/AIDS has. Next slide. There still remain a number of challenges on HIV and AIDS. There's been 2 million new infections in 2015. There's still 36 million people living with AIDS, and many of the new infections are among adolescent girls who are being exploited and abused by older men. So we need a lot of attention there. On TB, that's an area of great concern. It disproportionately affects the poorest populations of the world, including in the United States, killing 1.4 million people each year. And there's dangerous resistant strains that are more prevalent and easily spread today. So we do call for significant attention on TB, which has been broadly underfunded. And in malaria, we've had a lot of progress, but we continue to have 212 million cases in 2015, rising drug and insecticide resistance, threatening progress that has been made. Those affected typically lose 25% of their family's income as a result of their lost productivity, which affects the prosperity of society at large. So our recommendations focus on really what is the next generation of PEPFAR. And when we look at HIV and AIDS, it becomes very clear that we need more flexible funding targets between prevention, treatment, and care. We need to continue to transition the burden of financing to national governments. We think that we can leverage the PEPFAR platform to focus on more chronic care in places emphasizing prevention. Again, we need to target and focus on gender-based violence, and the Global Fund should be supported. So continue with PEPFAR and leverage the platform more broadly. On TB, we think that there should be a global threat assessment of TB to execute a plan for developing and investing in new diagnostics, drugs, vaccines, and delivering mortality. Again, with multi-drug resistant strands of TB and more severe, extensive drug resistant strands of TB costing 100 times more than non-resistant TB. So we really need to get on top of that. And it's been traditionally underfunded. And then on malaria, continue as we are, basically sustain the funding. The U.S. put in about $861 million in 2016. We think that the interventions in surveillance, prevention, treatment, and research should be sustained. And so we would recommend the President's Malaria Initiative being funded at current levels and continued, because it's been a great success. We'll move on to the next priority.
I'm also very honored to have been on this committee. I'm going to address the first area in enhancing productivity and economic growth, which is women and children's health. And like the U.S. performance in the areas that Jendayi just covered in HTB and malaria, the U.S. government's been a leader in this area, those areas, like it has been in women and child health. But there's still a lot to be done. And as you see here, the current state, we're very reasonably successful with our MDGs in reaching the targets for reducing mortality in children less than 5. Not quite so well in reaching the target for maternal mortality. And despite the progress, there's still 6 million children dying each year and more than 300,000 mothers dying each year, mostly in pregnancy. Secondly, this is what we call the Survive agenda. What we also, though, took up as a committee was to go beyond Survive with a lot of the new data that's come out in the last few years and deal with the issue of what we call Thrive. Given the fact that there are 250 million children that fail to reach their development potential because of extreme poverty and stunting, suboptimal development leads to poorer health, lower education attainment, poorer school performance, and most important, when they become adults, less earning power. Next slide, please. We have, of course, some remaining challenges. We have interventions that work. We can dramatically make progress in reducing a lot of this mortality, although some of them we still have to learn how to bring to scale. We need to recognize that undernutrition is responsible for nearly half of all deaths for children under 5, leading to stunting, and this leads to poor developmental outcomes. And we need to recognize that healthcare services and social services and women's health and newborn infant health services are often delivered separately, and that creates challenges for families. So if we turn to the third slide, what are our actions? I think clearly the committee felt quite strongly that we needed to invest in ending preventable maternal and child death. This should be accelerated. This involves, of course, the U.S. government continuing its work, but also the continued efforts of the private sector. As detailed in the report, there are many examples of where the private sector has been engaged in this area. There are very good evidence-based interventions, immunizations, management of the sick child, nutrition, good nutrition, prenatal care, and safe delivery and family planning, and we spell out the details in the report. But that's just the survive agenda. We must now also give equal and important attention to the thrive agenda. And here we had called on USAID, PEPFAR, and implementing partners to incorporate child development interventions that foster this agenda. And what do I mean by that? Well, that could include adequate nutrition, reduction of childhood exposure to violence, detection and management of maternal mental health issues, and support and promotion of early education and cognitive stimulation for children. A lot of good evidence now, as I've mentioned in the last few years, that we can make progress in the thrive area as well as in the survive area. To help do that, though, we also need to be sure that our health systems are patient-centered and package services for women and children, and look for existing platforms to deliver these packages.
Thank you. Now we are going to talk about cardiovascular health and cancer. First of all, non-communicable diseases is a huge problem today, and it is an epidemic. It kills 40 million people each year, and what is important, 3/4 in low and middle income countries. But in the bottom of the slide, you have the issue of not only is non-communicable diseases in general, but cardiovascular disease in particular is the #1 killer with 18 million deaths. What is most important, I think, aside of the mortality, is what is in the middle of the slide, is the second point, is the cost. The global cost of cardiovascular disease is estimated to rise to more than 1 trillion by the year 2030. And if we now look at all the 5 most common non-communicable diseases, cardiovascular disease, COPD, cancer, diabetes, and mental health, the total losses up to 2030 will be $47 trillion. The next slide. Obviously, the challenges are straightforward, but I'd just like to point out the last point, and that is the branding of non-communicable diseases in cardiovascular disease. We do not have a branding. We react, infections and so forth, but things that are long-term, like chronic diseases, which the cost is huge, we are not responding. And that, to me, is the challenge #1. And this leads to the needs, which I would like to summarize, making 3 important points. First, the U.S. Agency for International Development, the U.S. Department of State, and the U.S. Centers for Disease Control and Prevention, through their country offices, should provide seed funding to facilitate the mobilization and involvement of the private sector in addressing cardiovascular disease and cancer at the country level. Second, these efforts should be closely aligned and coordinated with the efforts of national governments and should strive to integrate services at the community level. And third, most importantly, where we focus, target and manage risk factors, smoking, alcohol use, obesity, for the mentioned non-communicable diseases, particularly through the adoption of fiscal policies and regulations that facilitate tobacco control and healthy diets. Second, detect and treat hypertension. 50% of the people who have hypertension, either they don't know or they are not treated appropriately. It's a huge issue. Third, detect and treat early cervical cancer. And finally, immunize for vaccine-preventable cancers, specifically human papillomavirus and hepatitis B vaccine. Let me give a message. We have a huge problem that we have to pay attention. Chronic diseases are being at the highest cost in developing countries, and we also have to pay attention in our own country, United States. So it's a huge issue that we really have to emphasize. Thank you.
This is Amy Batson. It's been a true privilege to serve on this committee. Now, as we've looked at these 4 priority health areas, the committee spent as much time as we looked at how do we really maximize the impact of the way that the U.S. government works and the way the U.S. government uses its resources. And in that, we looked at about catalyzing innovation, smart financing opportunities, and global health leadership to expand influence. Next slide, please. As we looked at catalyzing innovation, we realized that the tools we have available to us can have a huge impact on our ability to actually efficiently and effectively control diseases. Vaccines, drugs, diagnostics, medical devices and tools, and new frontiers in innovation like digital health, information technologies are already proving to have tremendous value. The U.S. government has been a leader in this space, as has the private sector and civil society and NGO community. However, we're still plagued that weak markets, combined with costly and uncertain R&D, can result in a lot of underinvestment. And we've already heard about the underinvestment in antibiotics, in the issue of having vaccines that are not only developed, but manufactured at scale to be addressing needs around the world, in some of the drugs, diagnostics for TB, that are going to be essential for us to make progress in these high priority areas going forward. Second, we're realizing that in the countries where these diseases are endemic, it's very important to also have the capacity to do medical product R&D, so that they are partners in the effort and can help rapidly and effectively drive forward this work. And the third challenge that we see is that even when we see a frontier like information technology with the tremendous advances that are occurring, it's being undermined by our approach, which is fragmented and duplicative as we seek to roll out this new type of innovation. Next slide, please. So as we think about how to address some of the key challenges we need to be looking at are, one, the types of push and pull mechanisms and incentives, push the investments in the R&D, pull the creation of incentives and markets that help to attract and leverage the private sector investments that help reduce the costs, the risks of the market, and the uncertainty. And currently, while we have a number of proven approaches, the actual scaling of these is inadequate. Second is addressing the weak and under-resourced R&D capacity that we have in the countries. This is both the human capacity as well as the laboratory capacity. And this under-resourced capacity can lead to tremendous delays in detection, diagnosis, and addressing these key diseases. And we certainly saw that with the Ebola outbreak in Guinea in 2013. And third, one of the big challenges is that many different donors sponsor more short-term and narrow goals, for example, in the space of digital health or information technologies. And the result of that is poor country ownership and often a lack of coordination, limited interoperability, and therefore limited effectiveness of these investments. Next slide. So the types of actions that we need to fully take advantage of what innovations can bring and how they can help us in our large goals is first having U.S. agencies develop and scale the kind of mechanisms that reduce R&D costs and that also address the market and R&D risks of developing, licensing, introducing, and scaling medical products that are needed for global health priorities. These can take the form of new adaptive trials, accelerating the regulatory process, as well as better market data to help drive down uncertainty. Second is having agencies such as CDC, NIH, and most notably Fogarty, and the Department of Defense investing to increase the number of trained people and equipped institutions in our partner countries to work with American researchers to be able to conduct the kind of clinical trials that are essential for us to move forward rapidly in the creation of these innovations. Third is around ensuring that the U.S. agencies are working with international stakeholders to convene and create a common digital health framework. The approaches, the principles, that ensures shared operability, supporting of country objectives, and country ownership. And last, that the U.S. agencies are expanding on the build once principle that was so well outlined in the Digital Gap Act, and that they are working to align U.S. funding in digital health to reduce our own duplication and fragmentation that can occur in our own investments. Next slide, please. One of the second areas that we saw tremendous opportunities for how we can work different, how we can work smarter, is through our financing mechanisms. There have been significant changes in the world about how health is financed. Not only who is financing and will be financing in future, but how that financing occurs. So first is that low and middle income countries' economies are growing, and many of these countries will be transitioning off of traditional foreign aid with their programs financed almost entirely domestically. Second is we see that some of our financing, or most of our financing, ends up being more short-term in its nature and more focused on vertical health programs. These can be very attractive to governments and decision makers because they can be easier to attribute to how my dollar had impact. However, often longer-term, more cross-cutting investments can have significant returns, and these tend to be under-invested in. Third, we've seen that rigorous economic analysis of the social, economic, and financial return is important to ensure the best use of those funds, and more importantly, to be able to engage different kinds of funders. And yet we are not doing enough of this analysis. And last, we have a number of proven examples about innovative financing mechanisms that increase the value of investment. Next slide, please. So some of the key challenges as we go forward is how are we ensuring that that transition to domestic funding in these low and middle income countries is done in a way that ensures sustainable financing? And how do we continue to support the fragile states, the low income countries that will do need to continued support? Second, how do we make that shift to have contributions more to health systems, for example, for pandemic preparedness, or to product development, for example, vaccine platforms that will have benefits to many, many countries, most importantly the US. But also recognizing that these are longer term and more difficult to attribute to a single partner. And finally, how do we take advantage of the growing opportunities to attract and leverage funding from private sector and from new investors such as impact investors? So last slide, please. So needed actions is a very important transition towards not only the short term, but also to the investment in global public goods, with USAID, state, and HHS investing in longer term catalytic funding. That we optimize our investments through smart funding strategies, for example, promoting ways that we promote greater country ownership and domestic financing that leverages US financing, that we use new, more flexible financing mechanisms such as USAID's Development Credit Authority, and that the US Treasury, state, US, and USAID work together to motivate World Bank, IMF, Global Fund, Gavi, and a number of other partners to promote this transition to domestic financing and to attract alternative financing sources with better data and financing mechanisms.
Mike Merson again. So I'm going to address the third area dealing with maximizing returns, and that's this very important area of global health leadership. And here, the committee looked first outwardly how the U.S. government should behave outside the United States, but we also took a look at how we could be better global health leaders by taking actions within our own country. So the report divides itself into two areas, and you'll see that on the slide. In terms of our current state, that global governance for health requires involvement of organizations that directly and indirectly impact health, given the social and economic determinants on global health. Obviously, agencies and organizations that deal with factors other than directly health. If you think of the UN system, there are close to 15 UN agencies that are not health agencies but have an impact on the world's health. So we need to look at health in a very broad context. Secondly, there are now more and more multilateral organizations that are critical parts of the global health architecture. Of course, one thinks of the UN, but also organizations like Gavi, Global Fund, and many of them are listed in the report. That's looking outward. In terms of inward, the committee felt that the U.S. system for health diplomacy is not as well suited as it could be to deal with a number of issues, particularly global health emergencies. Next slide, please. So what are some of the challenges? Well, first, the organization that gets the most attention naturally with health, the World Health Organization, performs very essential functions, yet is in need of reform and remains underfunded. Secondly, looking internally, there's lack of sufficient training leading to inefficiencies and weaknesses in our own health diplomacy actions, and that we don't have a very limited number of non-career health appointments, resulting in a lack of institutional knowledge and of a career track for global health professionals within the U.S. Foreign Service. So I turn to the last slide. These are the actions that the committee recommended. Again, looking outward first, the need for the appeal for the State Department and HHS to use their influence to improve the performance of key UN agencies, especially the World Health Organization. Our contributions to WHO are important, but they should come with a requirement that the reforms that have been recommended for a number of years are adopted. Secondly, that we should remain state and HHS should remain committed, strongly committed to global partnerships. A lot of global governance has to do with global partnerships. And the examples I've already mentioned, the Global Fund, Ngabi, but also the Global Health Security Agenda and the Global Financing Facility. And then thirdly, dealing internally, the committee recommended that to amend the Foreign Servants Act to enable global health experts within HHS, and that the State Department should create a global health career track. Both of these recommendations have to do with building up a career pipeline within our government, within state and HHS, for those who are experts in global health. We have literally thousands of students graduating today with expertise in this area and are very looking forward to having opportunities both in state and HHS in terms of longer-term careers. I think more than anything else, let me say that the U.S. really must maintain its leadership in global health and actively participate in global health governance, coordination, and collaboration. And this includes leadership to improve UN agencies, commitment and involvement in global partnerships that align with our goals, and a more strategic approach to global health diplomacy. I think it's back to our chairs.
Well, after the priorities that we set up, 4 priorities, and the 3 approaches of maximizing returns, we had the following conclusions in terms of what we would like to advise the government of the United States today. And I'd like to make 3 points. Point number 1, the health and well-being of other countries directly and indirectly affect the health, safety, and economic security of Americans. Second, taking more proactive and systematic approach will make the United States government's global health enterprise more efficient and cost-effective. And finally, United States global health strategy should include forward-looking policies, a long-term vision, country and international partnerships, and continued investment. Thank you.
So to conclude, our interests, again, are to secure against global threats, and we're talking about global health security against pandemics and addressing continuous communicable diseases, and also to enhance productivity and economic growth, particularly leveraging and working to save the lives of women and children for a healthy population, and addressing the cardiovascular disease and preventing cancer, the NCDs, which are such a huge economic burden. And we're doing this, we're trying to go after those 2 primary interests by maximizing our returns. So specifically, we want to harmonize digital technology, leverage it. We want to mobilize our people and our expertise. We want, by building this global health diplomacy track in HHS and state, we want to use greater and smarter financing. Obviously, money is an issue, will continue to be an issue, so we also have to do greater burden sharing so that we transition some of the financing for global health to domestic countries, and we need to utilize regulations, change the regulations so that we can better, the U.S. government, both Congress and the administration, working with the private sector, can achieve the results that we all want in global health. Thank you very much, and I think we may have a few moments for questions.
Sure. Those of you who have a question, if you can please go up to the microphone. And it looks like we have a first question here. If you can please identify yourself and your organization.
Thank you very much. My name is Jose Ramiro Cruz. I'm a member of the Ibero-American Collaborative Group for Transfusion Medicine, and also a member of the Education Committee of the African Society for Blood Transfusion. And, I'm here because one of our interests is global blood transfusion safety. And blood transfusion not only is an important vehicle for HIV, hepatitis B, hepatitis C, malaria, but also things like Trypanosoma cruzi, who has globalized from Latin America to the United States and Europe, also plays an important role in maternal survival. There's an inverse relationship between availability of blood at the national level and maternal mortality associated with hemorrhages especially. And, when you look at Zika, chikungunya, yellow fever, those are all bugs that can be transmitted by transfusion. So I'm just wondering, if the committee would consider including some specific statements about global blood transfusion safety, given also the fact that about 15 million Americans go to Latin America, and other countries each year to look for medical care. And most of the time, when there are emergencies, they don't have access to blood locally. So that's my question. Thank you.
Mm-hmm.
Let me just say you've identified a very important area that is one of a number of priority areas. It's one that's only going to become more important. The committee did not specifically address that, but within the context of overall public health importance, is clearly a very important issue.
Yeah, I would just add, in the report, it's certainly referred to in other parts of the report. For example, in maternal care, you need emergency obstetrics, as you know very well, if we're going to really make a final dent in reducing maternal mortality, and that's certainly referred to here. So I think the committee would agree with you that, and I think you would find in the report reference to strengthening of health systems, hospital care, trauma care is mentioned in a number of settings.
Thank you. And we have another question right here.
Thank you. I'm Dele Ogunseyitan. I'm a Jefferson Science Fellow here at the Academy on leave from my post at the University of California at Irvine. And I have indulged me to have two questions. In a few days, the World Health Assembly will proceed in Geneva, and I wonder, based on your recommendation, that U.S. contribution in funding should come with a pledge of reform. If you had a chance to share this recommendation with a large delegation going to Geneva very shortly. My second question is about global health education. I appreciate the recommendation to put global health diplomacy in the career path of the State Department, for example. But I wonder if you also had input from the academic community in terms of the training at the undergraduate all the way to PhD levels, because there's a lot of balancing balls on global health education that the Association of Schools and Programs in Public Health is dealing with now, and there's uncertainty about the curriculum. And thank you.
Who would like to take that?
Well, the report was only released today, but I believe there was on Friday, the report was given to the co-sponsors, the sponsors of the report, and that included HHS. So I hope it reaches the delegation going to Geneva, but certainly report's been conveyed to HHS, and we are aware of the new Director General being election and how important that is to the future of the organization. And a strong WHO will require a strong Director General. In terms of your education question, I'm from a university, and I can assure you that there was input from the Consortium of Universities in Global Health. They participated in the open session, and we've talked to a lot of universities, and they very much support, I'm sure, as you've intimated, the importance of global health diplomacy. It's a great interest to students. I think the U.S. government has a great opportunity to make use of the enthusiasm and expertise coming out of U.S. universities, and I'm sure our consortium, also the Association of Schools of Public Health, have been consulted, and they have many of these public health schools in America have global health tracks or global health programs. So I can assure you that that's happened.
Okay.
I'd like to make a comment about education, if I may. It is critical, and it goes into the capacitance. We need people really trained. And, here in this country, we have, for example, in NIH, the Fogarty organization, who has really, and I can speak firsthand, has been extremely helpful on that. I think this is a critical issue, the issue of education and how this is fostered. Otherwise, I don't think we will be able to go to these countries and to really help unless we have the people there to an exchange program and being appropriately funded. So I think is a very good question. And a final point about education, and this comes through the document, we feel very strong that we have to start educating our children. We are talking about health, and really we are not paying attention to the window of opportunity, which is the people who listen, who are the children. And I think this comes through the document in several parts, and is another aspect of education that I just wanted to emphasize.
And we're at the top of the hour, so we're going to get to 2 more questions, and then we're going to have to cut it short. So I apologize. And you were next in line, sir.
This is Tom Novotny. I'm Deputy Assistant Secretary at HHS and formerly of Academia with a PhD program in global health until coming here a year and a half ago. I had 2 comments. One, on the health diplomacy piece, I really strongly feel that that's an important track, and there's been considerable progress made. One thing that I think might be worth mentioning is the involvement of the Department of Defense in this. Military health diplomacy is another source of resources, lift capacity, and collaboration that I think needs to be considered. The second thing is the silo effect of separating infectious diseases from non-communicable diseases, something that I think could be addressed better too, in terms of things like, for instance, tobacco control and TB. 20% of TB mortality is attributable to tobacco use among the same sort of vulnerable populations. And I think it's important to think of some creative ways of combining our approaches to non-communicable diseases with our existing programs in infectious diseases. So just a couple of comments.
Thank you. And our last question?
Thank you. I'm Steve Morrison from CSIS. Congratulations on the report. It's very ambitious and very impressive and very timely, and it's quite useful that you've put all of this effort and come forward with this at this time. We know, of course, the FY18 budget will be coming out shortly. It's going to be terribly important that what you're arguing register with the Trump administration as well as with members of Congress. In the Trump administration, of course, health security is getting quite a bit of internal attention, but you've got a broader frame, which is a pretty deep populist skepticism of all of the various things that you're talking about here in your report. So my question is, what is your strategy of dissemination and connecting with both the Trump administration and with Congress at this particular moment, since it's going to be so important that you find a ready audience to engage?
Well, I can start quickly.
Excuse me. Go ahead.
Just to give a brief overview, we kind of have only the next maybe month or so of dissemination strategy worked out, but we do plan on meeting with staffers and members on the Hill on the various areas kind of that are relevant to their interests or the relevant committees. We also have some funding from PATH, which is very appreciated that we were able to start thinking about dissemination up front and not kind of after the fact. So we'll also probably be planning some follow-up meetings, some like this, briefings of more targeted and specific areas in the report, since it is, we do cover quite a few different areas in global health. So to try to get down into more of the details for that and do some more, create some more digestible products that will be easy for people to get a gist for everything. But that just is really carrying us through the next month or so. So if there are opportunities or ideas, we're very open to hearing more.
I would like just to point out that your question is critical. Dissemination, actually we spent almost 10 minutes talking with Dr. Zhao this morning about how this should be disseminated. In other words, this is important because we can come out from this room and then what happened, how people really know what we have done. So Dr. Zhao actually is very much into it, and maybe you can say a few words.
Undoubtedly, this is the most important question, right? A report is a report, its content is great, but someone's got to read it and agree with it and move forward with it. So I think dissemination is the most important thing we can do. You and I already had several discussions working along with CSIS. This afternoon, we're going to see Tim Zimmer and discuss this report. We actually have a number of other outreach already in progress. But importantly, we recognize the importance of Congress. So our congressional affairs person, together with, in fact, consultant, we're mapping Congress to extend to that as well. So although Megan's being quite modest, it's a lot more than a month. And I don't think resource is an issue here. It's really trying to do the right thing. So would love to talk to you some more about ideas. Valentin has some good ideas too. And so we, in fact, as we have done so many years, in every report we have dissemination strategies, so this is not unusual. What's unusual in this one, to be honest, is we're dealing with new players. And therefore, the connection with the new players and who they are, et cetera, is the kind of work that we need to do, and we're doing a lot of that stuff, and we need your help as well. Thanks.
Thank you. And with that, that concludes today's public briefing. Thank you all for joining us. Again, those via the webcast and those in the room. And one last plug, you can get the report at nationalacademies.org/US Global Health. Thank you.